Well, hello everybody. Happy Friday. Welcome to another edition of our Friday Live. I wanted to take a few minutes today to welcome many of our new members. I think with the addition of some of our health partners in health, this group has grown. And so I wanted to just come in here briefly and introduce myself, talk a little bit about Fit for Life, explain what you can expect as part of this group, and then answer a question that we received today. As always on Fridays, our goal is to come in here around noon and share a Friday Live. Sometimes we're just talking about the news and updates, things that are happening at Fit for Life. We are always open to questions that can be shared publicly or privately if it's something of a little bit more sensitive nature. And we aim to kind of come in here to teach and share and have, this is sort of the, our lifers, the backstage people, the people that have a little more attention than some of the things that you may see us sharing on social media. So if you hop on the live, please say hello so I can tell who's here. If you have any questions about anything we're talking about, you can chat in the comments and I will do my best to answer them. And I'm at home, so you may hear Marley barking in the background. So for those of you that are new and that do not know me, my name is Jennifer Neesett. I'm a physical therapist. I own Fit for Life Physical Therapy. We are in our 4th year of business. I am joined and helped tremendously by Jenna Volman, who is our Director of First Impressions, aka Office Manager, and Raven Anspaugh, who is the shining light, excellent physical therapist that joined us a year ago in January. And our mission is to help active people overcome pain and injury quickly so that they can get back to doing what they love. If you listen to us long enough, you'll understand that it is our soapbox that we believe physical therapists should be the primary care provider for people when non-emergent pain or injury strikes. And our patients come to us because they value that quick access, that relationship, the shortened learning curve, and the speed at which you can get back, get an answer to what's going on and get back to doing what you love. And you can do that by saving yourself time and money, avoiding waiting to get into a primary care doctor who doesn't really know what's going on with you anyways. You do not need a referral to see physical therapists. You do not need an image of any kind to get started with physical therapy. The special tests and the procedures that we are trained in and the differential diagnosis and the red flags that we know how to opt out, rule out, can help you get an answer to your problem and get back to doing what you love quickly. So that's a little bit about the practice. We are also joined by partners in health. These ladies are independent contractors, so they are LLC'd themselves, and they're not employees of Fit for Life, but we call them partners in health because they provide a valuable service to the community to which our patients have access. They rent space in our building, and they handle everything independently themselves. So from scheduling and payment and all of that, they handle that all themselves. We have the following list of providers. So we have Lindsay Whitaker, who is a massage therapist for the health of it. We have Allison Dondorfer and Sharice Goodrich, who are our certified health coaches. We have newly joining us is Shelly Plesha, who is a certified nurse practitioner. She'll see her first 2 patients in the office next week. Her specialty will be helping people who are struggling with hormones, so bioidentical hormones, and weight loss. So those are her specialties. I believe Shelly needs to get us her contact information in the group, so we'll get that to you guys. She does have cards and flyers at the office as of last night. So those are the partners. And also, just of a little clarification note, as of May 1st, Joyce Amino, who is a personal trainer, she is no longer officially going to be seeing clients at Fit for Life, just for the reason of basically rent space. She is still a personal trainer. She is still open to people that are interested in using her services. She's just going to be seeing clients outside of Fit for Life. So if you're interested in talking with her about her services, you can still reach her. Her information is still in the group. She's just not necessarily partnering with Fit for Life anymore in terms of seeing patients right in our space. So I just wanted to clarify that. For those of you that are new, there are a few resources that I'd like you to be able to take advantage of. The featured section of this group, which in old Facebook used to be called the pinned section, it's basically either on your phone or on your laptop. It's the section at the very top of the group. Everything stays up there that's kind of pinned to the top in the featured section. That's where you can find information on the Partners in Health. That's where you can find the Ask About Availability page, which is a landing page that we use for people who are curious about what it is that we do, that want to either talk with Jenna or Raven or myself before they schedule. You can find that in the featured section. There's also a welcome video where I kind of talk about the group and what its purposes are, and encourages everybody to introduce themselves below. And finally, there are several free guides, free resources that we have that are available to everyone. Raven and I are strong believers in prevention, and we want to share as much information with you guys up front to keep you healthy as we can. So the few things that you'll find there, we have the best morning and evening stretches. That's a PDF. We have a PDF with 10 exercises to fix your flat feet. We have a nagging neck pain video that gives you, I think, 3 tips to fix your nagging neck pain. And then the big one we have is a free ebook that I created called Solving the Mystery of Back Pain. You can find all of those in the featured section of this group. The video you can watch, there's no opt-in necessary, but the other ones you kind of give us your email address, and then you get the PDF as a download that you save to your phone. So that is about the featured section. And the rules of the group are just be kind. It's a safe space. No selling anything here besides the information that we share with you all, and be good humans, basically. And so for today's topic, we will talk a little bit about the question that we got from Dana, who may have heard the answer to this question before if she asked her daughter. But I do definitely appreciate asking the questions, because a lot of times I think people have questions and they are afraid to ask. And there's no silly question, and your question may help somebody else. So as always, if you're leery to ask a question publicly, you can always message us privately, and we can answer them that way. So the question posed today was, can physical therapy help nerve damage? And the answer is absolutely yes. Many of you that have been treated by me, and probably Raven also, will know that when a physical therapist gets asked a question, they often have follow-up questions to that. So to the question, can a physical therapist help with nerve damage? My question is, well, what kind of nerve damage are we talking about? Because there are different types of nerve damage, different levels of nerve damage. And so I'm going to give you like the overview, and just know that if you're someone who has personally experienced nerve damage, what I'm going to say may not be specific to your problem. We have to see the patient, see what's going on, what the involvement is, to be able to know for sure, like, what the prognosis looks like, how long is this going to take, and what do we need to do for you. So to simplify, your brain and spinal cord are in charge of everything. And off of your spinal cord branch all the nerves that go out into your body. If you have an injury in your brain, then the nerves are going to be affected in the body on the opposite side of the brain injury. And that's because the brain and spinal cord, there's a cross. Don't remember what it's called. Raven probably does. It has a name. But if somebody has a stroke on the left side of their brain, then what you need to understand is the right side of the body is going to be the impaired body, and you'll see someone with weakness on the right side of the body because of that crossing at the level of the spinal cord. So if you have a brain injury, then the physical therapy is going to work on the nerves on the opposite side of the body to help loosen up, strengthen. A lot of times there's tone involved with that. The arm or leg will kind of draw up, and you can work to kind of get strength back there. You can also have a injury at the level of the spinal cord. That can be traumatic. It could also be something that slowly happens over time. If it's at the center of the spinal cord has a great big opening right down the center where the whole spinal cord runs, and then it's got holes on the sides where the nerves go out. So if you have a spinal cord injury at the center, it can be a complete injury, which means the spinal cord is completely injured, in which case everything below the level of that injury will be wiped out and you are paralyzed. You can also have partial level spinal cord injury, in which case there's some function but less, and depending on your injury and the level of the injury will determine the therapy that you need, and that will be very specific to the level of the lesion of the spinal cord. You also can have an issue in the spine if you have something that gets in the way of the spinal cord, either at the center or on the sides, and a lot of times that can be from a disc bulge or disc herniation, which can again be central or on the sides, or it can also be like arthritic or degenerative in nature, and over time the canals become more narrow, and that can cause some compression of the nerve. If that's the case, you're going to experience pain or weakness or numbness or burning or whatever the pathway is that's involved along that distribution of that particular nerve. So we often can tell the level of the spine that's involved by the location of the symptoms in the extremities. That's our job. So in that case, the physical therapy would be around trying to reduce the compression at the level of the spine with movement-specific exercise, strengthening, stretching, that sort of thing to address the issue, and then to the primary issue and then the secondary issue. We almost always in physical therapy take things back to the level of the spine. No matter what we're seeing you for, we have to make sure that your issue isn't coming from your spine, because it is in charge of everything, and oftentimes things can be related. So we have to treat the cause, which is the compression or irritation at the spine, and then we can focus on the symptoms, which may be the weakness, tightness, numbness, tingling, that sort of thing, any reflex changes, any of the other things that we might see. And then the last nerve damage that you may experience would be a peripheral issue or a peripheral injury. There are lots of different things that can happen. You could sustain a fall. You could sustain a fall on an outstretched arm, or when the arm gets tractioned and have a traction type injury to your brachial plexus. There is a long thoracic nerve that innervates the serratus anterior that can get compressed or stretched, and then we'll see a wonky scapula, your shoulder blade doing something funny. People can sustain a blunt trauma to the lower leg or to the elbow, to the shoulder, to really any extremity, and sustain a compression or a tensile nerve injury. And again, the rehab for that is going to be specific to what the nerve damage is and to the muscles that those nerves go to. So the nerves innervate the muscles. And so when you have nerve damage, I often describe your nervous system. Your nerves are like the electrical wires in your house. It's like electricity. So your nerves carry the electrical message that gets the muscles to contract. So if for any reason the conduction is slowed or absent, then the muscle is going to waste away and weaken. And so physical therapy can be very helpful in safely grading movement as we are dealing with the injured nerve and what it involves. And we have several patients that I'm thinking of right now that we're doing this with, people that have sustained peripheral injuries or spinal cord issues, and we are helping progress them. So we can work on joint protection, making sure that if it's a shoulder that has lost muscle support because of the nerve injury, that we use external supports if necessary. We can show people how to safely keep moving with the injured nerve, because as you all know, movement is medicine, and if we don't move, then there's no joint lubrication, and message information from the brain to the muscle and the body part helps too. So we can protect the joint, we can help with movement maintenance, we can help with soft tissue integrity, just kind of keeping blood flow to the area can be helpful. If there are soft tissue restrictions, we help loosen them up. And then again, safe exercise progression, because you may have to scale back what you're used to doing so that you can do the exercises correctly to stabilize with the muscles that you have. And so that can be very, very important to help prevent you from getting injured as you are rehabbing the nerve damage. So, and then the other thing I would say is you have to be very, very patient with nerve issues, because nerve regeneration is very, very slow. It's painfully slow. And so depending on the severity of the injury, it can take a very, very, very long time for a nerve to heal, depending on the level of damage that it has sustained. So that was a 3,000-foot view and some general explanation. I hope that answered your question, Dana. If anybody has specific questions about their issues, you're always welcome to ask them below. I will stop talking because I'm always longer-winded than I intend to be. Thank you guys so much for watching. If you've watched all the way to the end, you are a winner. Welcome to our group. Welcome to our Fit for Life family. And just know that we're thankful that you're here, whether or not you've experienced our services at Fit for Life as a patient, or you are incoming because you are connected to one of our partners in health. We value your trust. We appreciate that you are here, and we look forward to serving you and to help keeping you fit for life. Thank you, everybody, and have a great weekend.